we're thrilled to have you. And for those of you who didn't know, Vince Redmond, licensed marriage and family therapist, but somebody who worked as a behavioral therapist for many, many years, is actually featured in the video Recovered. Vince, we're so thrilled and lucky to have you.
Oh, thank you. So what's the topic? What were we just talking
Well,
about?
we talked, Wyatt had a seizure, his second seizure, and now we're investigating whether he has seizure disorder. I'm dealing with trying to get him into specialists, testing, all of that. And obviously my anxiety is, well, it's through the roof.
Yeah.
It's crazy.
It's on the ceiling.
And, you know, we've talked about parental anxiety before and what you can do, but also it brought up the topic of, this is the second time he's had to go to the hospital for a seizure, how to language that to your kids so they understand what's going on and aren't completely petrified themselves of the situation.
Right. Well, first off, I'm sorry to hear that. I'm sorry to hear that,
Thank
that
you.
he had another seizure. I know it's been a long time since he had one. So
He had one
that's
6
scary.
months ago, and that was the only one he'd ever had. And now he's had another one that was a grand mal seizure. And now it looks like once you've got two, you've got to take this more seriously and investigate medications and that kind of thing.
Right. And like you said, that's scary for everyone. I mean, everyone's anxieties are now heightened. And I think, that, you know, for first thing is controlling our own anxiety, right? Making sure that we get the answers that we need from the doctors and talking with them. But as for Wyatt, he doesn't know what's going on, right? This
Right.
is just something that happens to him. And we, you know, without getting into all the medical jargon and so forth, we need to just let him know that, you know, something in his brain is short circuiting and it's kind of turning him off for a little bit. And the doctors are going to help us keep you on.
Mhm.
Right? So that we can put it maybe more in terms that he would understand, but feel a little bit more confident and comfortable that mom is working with the doctors. We feel good about it. We're going to be able to take care of this. The other thing is making sure he feels that he did nothing wrong, right? There was nothing that he did that made him feel this way or that
He actually
did.
said to me, I'm sorry I had a seizure after it was over. So that's something that's important to know.
See, exactly, and that's what I was thinking, is that a lot of times our kids will feel bad that they, you know, they see the anguish in mom's face when they come to, they see all the people and, you know, hospitals and, you know, emergency rooms and all this, and they feel that they're responsible for these things, and these are things that obviously, you know, they don't have anything to do, with the result of it. So first thing we want to do is ease that anxiety, ease the anxiety of there's nothing wrong, you're okay, we're gonna take care of you. This was something that just happened, so that it brings that anxiety down for them, and they're a little bit more receptive then at that point to actually learn maybe a little bit more of what happened, so that, you know, if you're seeing a doctor or you're getting a consult, they don't have any guilt, they don't have any sense of anxiety that they're going to go to the doctor and the doctor is going to say that they did something wrong, that they, you know, are going to get in trouble in a way. I know sometimes this doesn't seem rational for us, but if we put ourselves in his shoes, you know, when he sees anguish, he sees upset, he sees a lot of stress in people's minds or in their faces and their bodies when he comes to, he immediately thinks that he did something wrong.
Right. So that's important to know. Yeah.
Okay, we had a question that came in from a viewer that we've had a lot of people asking this, and it really comes hand in hand with some anxiety with parents. In this particular question, she says, I have a 9-year-old with autism and intellectual disability, some speech, but lacking full communication skills. She says, would it be wise to take her out of school at this point and put her in a 40-hour intensive ABA program? She's tested at a mental age of 2 to 4 years old, but she will be 9 years old this month. And we have a lot of parents that are asking this question. They've heard that you can take somebody out from medical necessity, but I know that for parents, they get a lot of pushback from the school on this, Vince. And I wondered if you could address that a little bit about, you know, how to prioritize whether you should do this or not.
Yeah, and you're right. I mean, I think we have a lot of families that come to us with the same type of question. I think the first thing comes to assessments, right? Is doing all the formal assessments as well as, you know, an assessment for applied behavior analysis, ABA therapy, to really see if this is the right modality for them that would help their child learn, right? With intellectual disabilities and autism, each kid learns in different ways. It could be with more visuals, more audio, more, sometimes it could be more selective learning. So what we want to do is do a full analysis, full, assessment, looking at all, the IEP goals, looking at the assessments they've done in school, see what learning processes have been successful with them at school, and then again, assessing them for the appropriateness of ABA, so that we can then present a full comprehensive report to see if, in fact, we believe that prioritizing ABA and more one-to-one learning would be more effective than school learning.
Wonderful. Because I know that's a really tough decision to make about, and schools will, try to tell you that your child has to be in school. But there are laws that say if your child has something that's medical necessity, that you can pull them out.